70 maternal deaths last year were preventable, finds Karnataka government audit. Health Minister admits failure. Karnataka was jolted in November last year when the Ballari District Hospital witnessed 5 maternal deaths after caesarean births in a span of 3 days from November 911. An interim maternal deaths audit report in Karnataka by an 8-member, state-level expert committee has found that of the 464 maternal deaths from April 2024 to December 2024, a whopping 70% were preventable. Karnataka was jolted in November last year when the Ballari District Hospital witnessed 5 maternal deaths after caesarean births in a span of 3 days from November 911. The uproar led to the government cracking down on the usage of an IV solution, called Ringer's lactate solution, from a pharmaceuticals company in Bengal, which was found to have endotoxins. A government interim report on the maternal deaths has now found that 18 such deaths took place between April and December last year because of the solution, with Ballari seeing 5 of them. The findings of the audit report were revealed by Health Minister Dinesh Gundu Rao in a press conference in Bengaluru, who admitted that there was a failure in the system, and that the government would work towards bringing the preventable deaths to zero from the 70% now. Data from the report shows that of the 464 deaths that Karnataka witnessed from April to December, 103 deaths 22% have taken place Indiana private hospitals, while 305 65% have taken place Indiana public health facilities. A total of 68.75% 319 cases of maternal deaths during this period were high-risk pregnancies HRP, while 31.25% 145 were non-HRP. Of the 18 cases of maternal deaths due to Ringer's lactate solution, 5 are from Ballari, 4 from Raichur, 4 from Bengaluru urban, 3 from Uttarakhand and 1 each from Yajirai and Belagavi. Rao said after the Bengal-based pharma company Pascombanga, which supplied the solution, was blacklisted last year, 112 cases had been registered and all were pending in court. Rao added that ever since the batches of the solution were stopped from usage, maternal deaths have seen a decline this year, with January recording 32 deaths, February seeing 34 and March seeing 36 deaths. The audit report has also revealed that of the 464 deaths in the span of 9 months last year, it was established that there was negligence of the service providers in at least 10 cases. When asked about the action taken against the staff, Rao said there were no suspensions but an inquiry was underway after notices were served. Among the leading causes of maternal deaths during the period, hypertensive disorders in pregnancy 153 cases at 33% or hemorrhage 125 cases at 27% and sepsis 42 cases at 9% have emerged. American Samoa the leading causes. Of the 464 maternal deaths, 63% of the mothers underwent caesarean operations, while 37% had normal childbirths. Taking note of the lapses in maternal care, the Department of Health and Family Welfare Services has placed 27 recommendations for facilities in Karnataka. Among the recommendations, capacity building, strengthening the facilities with equipment and drugs, strengthening blood storage units, mandatory hospital stay of 3 days following normal births and 7 days following caesarean operations, preventing unnecessary caesarean births are some of the key ones. Nan.